Hello everyone, welcome back to Nursing Guru YouTube channel. Today we are going to study the OBG, the topic or the unit, 4th unit, that is Physiology, Management and the Care during the labor. In that first we are going to study what is normal labor and the birth. Normal labor and the birth means here the normal labor, it is the process by which the fetus, placenta and the membranes are expelled from the uterus. The normal labor means it is one of the process in which the fetus, placenta and the membranes are expelled. It is going to come out from the uterus through the birth canal after the normal gestation week. The normal gestation week is 37 to 42 weeks. In that, before that or at the time of 37 to 42 weeks, the gestation week, the fetus, placenta and the membranes are expelled from the uterus through the birth canal. This we will call it as normal labor. In this pregnancy or the normal labor, this process will be the uterus and the fetus, placenta and the membrane will expelled from the uterus spontaneously, means one time, and cephalic presentation will be there and without any complication of the mothers and the baby. That we will call it as normal labor and the birth. Normal labor and the birth, it is the process by which the fetus, placenta and the membrane expelled from the uterus through the birth canal in the normal gestation week without any complications to the mother and also the baby, and it will comes at once. And cephalic presentation, it is the normal presentation. The normal thing should become 37 weeks or 37 to 42 weeks also normal gestation week without any complication. Placenta, fetus and the membranes are expelled from the uterus. That we will call it as normal labor. Next, the characteristics of normal labor will be, it will be the spontaneous onset of the labor, and once the baby or the fetus is going to delivered. Next, cephalic means the head presentation will be there. Cephalic, this is the normal presentation. Then gestation week will be 37 to 42 week. Normal gestation week should be there, and progressive cervical dilatation and effacement. 10 centimeter up to 10 centimeter dilation. Then thickness of the cervix should be in the normal labor. Next, vaginal delivery without any surgical intervention. Then healthy mother, no complication for the mother also and for the newborn also. There is no complication. So, healthy mother and the newborn should be delivered. That are all the characteristics of the normal labor. It will be the spontaneous. Once the fetus will expel from the uterus, then cephalic, normal cephalic presentation or head presentation. Normal gestation week should be there, 37 to 42 weeks, and progressive cervical dilatation, 10 centimeter in first stage. Then effacement, thickness of the cervix. Vaginal delivery without any surgical instrument, without any using the surgical instrument, the normal vaginal delivery is going to happen, and there is no complication for both mother and the fetus. These are all the characteristics of normal labor. Next, what are all the stages of normal labor? First stage, second stage, third stage and the fourth stage. In the first stage, we will call it as dilatation stage. Here it will begins at the true labor pain. At the time of true labor pain, it is going to start and it is going to ends with the completion of 10 centimeter dilatation. It is going to ends with the completion of 10 centimeter cervix dilatation. In cervix dilatation, two phases are there, latent phase and active phase. Latent phase means this is going to 0 to 4 centimeter dilatation of the cervix, we will call it as latent phase. So 4 to 10 centimeter, we will call it as active phase. So the stages of the normal labor, in that first stage, that is dilatation stage. The name indicates it's going to dilate, the cervix is going to dilate until 10 centimeter. It is going to, the first stage is going to begins with true labor and ends with the it is going to start with or begins with a true labor and ends with a cervical dilatation 10 centimeter. The phases of cervical dilatation, latent phase and the active phase. Latent phase will be start from 0 to 4 centimeter dilatation. Active phase will start from 4 to 10 centimeter. This is regarding first stage. Then second stage, it is called as expulsion stage. It will begins with a full cervical dilatation. It is going to start from the 10 centimeter dilatation of the cervix and it ends with the birth of the baby. The birth of the baby until it is going to ends, it is going to begins with a cervical dilatation 10 centimeter and delivery of the baby, that is second stage. First stage, it is going to dilate. The cervix is going to dilate until 10 centimeter. First stage or latent stage 0 to 4 centimeter, active stage 4 to 10 centimeter, that is first stage or dilatation stage. Second stage, that is expulsion stage. Here the baby is going to expel. It is going to, this stage is going to begins with the full cervical dilatation and 10 centimeter and it is going to ends with delivery of the baby. This is second stage. Then third stage, placental stage. Here this is going to begins from the expulsion of the baby to the expulsion of the placenta. It is going to begins after the birth of the baby, ends with the delivery of the placenta and membranes. It is going to start or begins with the birth of the baby. Second stage was expulsion stage. Here it is going to begins with the cervical dilatation, ends with the delivery of the baby. Third stage, placental stage. Here it is going to begins with the delivery of the baby and it is going to ends with the delivery of placenta and the membranes. Fourth stage, recovery stage. First for 1 to 2 hours after the delivery, it is going to start with the observation or recovery phase, we will call it as fourth stage. Here mother 1 to 2 hour after the delivery timing, that we will call it as recovery stage, and also mother is going to monitor for bleeding and vital signs. These are all the 4 stages of the normal labor. First stage, dilatation stage. Second stage is expulsion stage. First stage, it is going to begins with the cervical dilatation. Begins with a true labor to the it is going to ends with cervical dilatation 10 centimeter. Latent stage and latent phase and the active phase. Latent phase means 0 to 4 centimeter is going to dilate. Active phase means 4 to 10 centimeter. These two are latent and the active phases are the phases of cervical dilatation. Next, in second stage expulsion, here the delivery of the baby, it is going to begins with a cervical dilatation. The continuation it is. The cervical is going to dilate in the first stage. The continuation, the cervical, from the cervical dilatation to the birth, delivery of the baby, that is second stage. Then in third stage, the delivery or birth of the delivery of the placenta and the membranes. Delivery of the placenta and the membranes, it is going to begins after the birth of the baby. Fourth stage, it is going to start from the 1 to 2 hours after the delivery, and this is also called as observation phase or observation stage. Here we are going to monitor the mother for bleeding or any vital signs, any changes in the vital signs. This is regarding stages of normal labor. Next, this is the stages of normal labor. See, you can see the first stage, it is going to begin onset of true labor pain. Then it is going to ends with a 10 centimeter dilatation of the cervix. Here the cervix dilatation phases include latent and the active. Latent is going to it indicates 0 to 4 centimeter dilatation of the cervix. Active phase 4 to 10 centimeter of the dilatation. See, you can see the dilatation from here to here, we will call it as first stage or latent phase from 4 to 10 centimeter. Active phase, this is first stage or dilatation. Second stage, it is going to begins with a full cervical dilatation. After the cervix dilatation, it is going to continue 10 centimeter and ends with the birth of the baby. Here the strong uterine contraction will be there, mother having urge to push. Crowning means the visible of the head at the cervix area and birth of the delivery. This is the crowning, the visibility of the cephalic of the fetus. Then the birth of the head and the birth of the baby, that is occurs in the second stage. Then third stage, it is going to begins after the birth of the baby and ends with the delivery of the placenta. After the delivery of the baby, it is going to ends with placental delivery. Next, last stage, it is going to begins after the delivery of the placenta to the recovery or 1 to 2 hours after the delivery. Monitoring the vitals, observation of bleeding and uterine contraction and recovery. This is fourth stage. The duration of each stage varies from the woman to woman. First stage 6 to 12 hours in the primigravida, 2 to 8 hours in the multigravida. Second stage, it will start 15 to 60 minutes. 30 stage 5 to 30 minutes, and last stage 1 to 2 hours. This is regarding stages of normal labor. The normal labor, it is the process in which the expulsion of fetus, placenta and the membranes from the uterus through the birth canal without any complication for the mother and also the fetus or newborn, that we will call it as normal birth. The characteristics includes without any complication, it will be spontaneous without any complication for the mother and also the fetus. Then cephalic presentation will be there, and normal gestation week only the mother is going to give the birth for the baby, and progressive cervical dilatation will be there and effacement will be there. This is the characteristics. Then the stages includes first, second, third and fourth. The dilatation stage, expulsion stage, placental stage and recovery stage. Dilatation means cervix dilatation until 10 centimeter. Expulsion stage means delivery of the baby. Then third stage, placental delivery of the placenta, recovery means observation. This is regarding stages of normal labor. First, second, third and fourth. Next will be onset of the birth and the labor. Onset of the labor, it is beginning of regular uterine contraction that leads to the progressive cervical effacement and dilatation resulting the birth of the baby. Onset means here the labor is going to beginning to the normal uterine contraction will be there. It is going to progressively thickness of the cervix and also the dilatation, complete 10 centimeter dilatation. It will resulting in the birth of the or delivery of the baby, that we will call it as onset of the birth or labor. The onset of the labor, it is beginning to the regular or regular uterine contraction will be there, that going to leads to the cervical effacement or thickness and complete dilatation of the cervix and the resulting in the delivery of the baby. The signs of onset of labor: regular uterine contraction that begins stronger, longer and the more frequent. Cervical effacement, thickness and the dilatation will be there. Show will be present in the onset of the birth or the labor. The blood stain, mucus like a discharge will be discharged from the vagina, that we will call it as show presentation. Show means the blood stains are going to discharge from the vagina. Then rupture membrane, the watery breaking from the uterus, that we will call it as rupture of the membrane. Then descent of the presenting part, it may be cephalic or breech presentation, which all the presenting part is going to present, that is going to descent, or it is going to descend the presenting part. That is the signs of onset of labor. The onset of labor, it is going to beginning from the uterine contraction, it leads to the effacement of the cervix and also cervical dilatation and resulting the delivery of the baby. The signs includes uterine contraction will be there, effacement, show presentation, show and descending of the presentation and also the rupture of the membrane. This is regarding onset of the birth and the labor. Next, the types of onset of labor: spontaneous labor and the induced labor. Spontaneous, it begins naturally without any medical intervention, but induced means labor will start artificially using the medication or any procedure, that we will call it as induced labor. I said already, the onset of labor, it is going to begin in the uterine, normal uterine contraction will be there, and the normal effacement, cervical thickness, and also the normal dilatation without any external medication or without any external procedure. We are going to deliver the baby, or it is going to happen, the uterine contraction or the effacement or dilatation is going to happen, that we will call it as spontaneous labor. If we are going to give the artificial, if we are going to do the labor or delivery by using artificial any medication or procedure, that we will call it as induced. Spontaneous means without any medication, normal vaginal delivery, or before normal vaginal delivery it is going to result. Before that, cervical dilatation, thickness, and the uterine contraction will be there, that will occur in the spontaneous. If it is not going to happen, we are going to do in the artificial medication. These are the two types of onset of labor. Next, per-vaginal examination. The per-vaginal examination is an internal examination of the female genital tract performed by insertion of gloved finger into the vagina to assess the cervix, presentation part of the fetus, and also progressive labor, to assess any complication or presenting part of the fetus, or any vaginal cervix, to assess the dilatation and presenting part, and also the progress of the labor we are going to assess by the per-vaginal examination. The per-vaginal examination are the internal examination of the female genital tract to assess the presentation part of the fetus, progress of the labor, and also the cervix dilatation and effacement. Here the purpose is to assess the cervical dilatation and effacement. Dilating until 10 centimeter dilatation we are going to assess by the per-vaginal examination, and also the thickness of the cervix. Next, to determine the fetal presentation and the position, to assess the descent of the presenting part, and also to check the status membrane of the intact and rupture, monitoring the progress of the labor. This is the per-vaginal examination. Per-vaginal examination, it is the internal examination of the female genital tract by using the gloved fingers to assess the cervix dilatation, thickness, and the progress of the labor, and also the presenting part of the fetus. The purposes includes to identify or to assess the cervical dilatation and the thickness, and also to assess the presenting part and the position of the fetus, and also to assess the descending the part, which the part is going to present, whether it is going to descend or not. To assess that also, we are going to main thing to, at the time of engagement we are going to do this point to assess the descent of the fetal presenting part, and also to check the status of the membrane, intact and rupture of the uterine membranes, and also to assess the progress of the labor. This is the purposes of per-vaginal examination. Next, by doing the per-vaginal examination in the labor, what are all the findings we can assess? Cervical dilatation until 10 centimeter we can assess by the per-vaginal examination, and also the thickness of the cervix and the head relation between the ischial spine, in the pubic. At the time of engagement, the normal labor, the mechanism of the labor in the first point is engagement. Here the fetus head will be fixed in the ischial spines of the pubis, that we will call it as station. To assess that also, we will do the per-vaginal examination, and to assess the presentation, it may be cephalic or malpresentation, and to assess the membranes, whether it got ruptured or intact. To assess or to identify or findings in the labors through the per-vaginal examination. I already said in the purposes, so to identify the cervical dilatation until from the 0 to 10 centimeter, and also to assess the effacement of the cervix, to identify the station of the fetus head, Then presentation, cephalic or any other malpresentation, and also to assess the membranes whether it got intact or ruptured. This is regarding findings in the labor. Next, organization of the normal room. Before that, what all we have studied means the normal labor and stages of the normal labors are important. Normal labor, normally the fetus, placenta and the membranes are expelled from the uterus without any complication, and in the normal gestational week, between the 37 to 42 weeks, that we will call it as normal labor. Characteristics, spontaneous and onset labor will be there, and single pregnancy, single fetus, once it is going to deliver, the fetus is going to deliver, and the normal cephalic presentation will be there. Normal gestation, in between the 37 to 42 weeks there will be a delivery, the gestational week. In this week there will be a delivery of the baby. Then progressive cervical dilatation until 10 centimeter and effacement, thickness of the cervix will be there. Vaginal delivery without any surgical intervention, healthy mother and without any complication for the mother and the newborn, there will be a delivery. These are all the characteristics of the normal labor. And stages, first stage, second stage and the third stage. First stage it is dilatation stage, second stage it is the expulsion stage, third one it is placental stage, fourth it is also called as recovery stage. First stage dilatation, cervix dilatation, it is going to start from the true pain to the cervical dilatation, complete cervical dilatation. Second stage expulsion, it is going to begins from the complete cervical dilatation to the birth of the baby. Third stage, placental stage, it is going to start from the birth of the delivery to the expulsion of the placenta and the membranes. At the last recovery stage, it is going to start or begins from the delivery of the placenta and the membranes to the ends with 1 to 2 hours after the delivery, or also called as observation stage. Next, onset of birth or the labor, it is going to beginning of with the uterine contraction that is going to leads in the cervical effacement, dilatation and resulting in the birth of the delivery. The types of onset of labor, two types, on spontaneous labor and induced labor. Spontaneous labor means without any medication or external artificial medication or artificial procedure, without any medication, medical intervention, we are going to naturally the baby is going to deliver, that we will call it as spontaneous. Induced means by using, or it is going to start with the artificial by using the medication and the procedures. Two types of onset of labor. Next is per vaginal examination. Per vaginal examination, it is an internal examination of the female genital tract to assess the cervical effacement, dilatation, then cephalic the presentation part of the fetus, and also the progress of the labor to assess the cervical dilatation, presenting part, position and also the station. The fetal cephalic part will be attached to the this ischial spines. That station we will assess presentation and the membrane, it got ruptured or intact. Next is organization of the labor room. How we are going to organize the labor room? It is a specialized area in the hospital designed for the care and management of the woman during the labor, delivery and after the immediate postpartum period. We are going to study here how the labor room is going to organize in the hospital. The labor room, it is the specialized area which is present in the hospital. Here it is designed for the care and the management of the labor during the labor and also at the time of delivery and also after the delivery, immediate postpartum, after the delivery period. We are going to care and manage the woman at the time of labor or during labor, delivery and also at the after immediate postpartum. That area or present in the specialized area which present in the hospital, that we will call it as labor room. The layout: reception and triage area should be there, examination room, first stage labor area, delivery room, newborn care, recovery and postpartum. These are all the area which is present in the labor room. The labor room, it is a specialized area which is present in the hospital. It is helps to care and management of the labor during the women during the labor, delivery and the postpartum period, that we will call it as labor room. In this labor room, which are all the areas should be there? Reception and the triage area, examination room, first stage labor room, delivery room and the newborn care corner and recovery postpartum area. Then drugs, which are all the drugs we are going to use in the labor? First one, oxytocin. It is helps indication and uses and also the dose and route here. It is induce and augmentation of the labor, prevention of PPH, postpartum hemorrhage. To prevent that, we are going to give the oxytocin. Then misoprostol to prevent and treatment of the PPH and also induced labor, magnesium sulfate. Induced labor I already explained before, spontaneous labor and induced labor. In induced labor, we will give the artificial medication or procedures. So, to do that, we are going to give the misoprostol. This is the medication for the induced labor also. Then magnesium sulfate to prevent a treatment of eclampsia and also in a severe pre-eclampsia as prescribed. Then next we are going to give the tranexamic acid to treat the postpartum hemorrhage, 1 mg IV within 3 hours of the birth, within 3 hours of the birth. Then lignocaine 1 to 2% local infiltration, episiotomy. After the episiotomy, at the time of episiotomy and repair of the perineal tears, we are going to give this one. Then ampicillin, maternal infection, any infection at the time of infection for the mother at the time of pregnancy or at the time of labor, we are going to give ampicillin for it may be bacterial infection. Then last one, metronidazole for anaerobic infection treatment. These are all the medication which we are going to use in the labor time. Next is, okay, in that first we are going to study the first stage of normal labor. The first stage, what are all the physiological changes will happen and physiology of the normal labor in the first stage. The first stage of the labor begins with the onset of the true labor pains and ends with the complete dilatation of the cervix. I already explained in the stages of the normal labor. In this again the phases of first stage of the labor, that is latent phase and the active phase. The latent phase, here the cervix is going to dilate from the 0 to 4 centimeter. Latent phase means the dilatation. In the first stage, it is going to dilatation. It is also called as dilatation stage. In dilatation stage, the cervix is going to dilate until 10 centimeter. In the latent phase, in the first stage of the latent phase, it is going to, the cervix is going to dilate from the 0 to 4 centimeter and contraction will be, mild contraction will be there. Effacement will be start in the first stage of the latent phase. The effacement, the thickness or thickening, thickness of the cervix will start in the latent phase of the first stage. Then duration in the primigravida, it will be up to 20 hours. If it is a multigravida, it will be up to 14 hours. This is the first stage of first phase, that is latent phase. First stage also called as dilatation phase or dilatation stage. In that again two phases, latent phase and the active phase. Latent phase means the cervical dilatation from the 0 to 4 centimeter. Here the contraction, uterine contraction will be mild and the cervical effacement will begins in the latent phase, and the duration for the primigravida and the multigravida is different. In the primigravida up to 20 hours it's going to take the time, and in the multigravida up to 14 hours. This is regarding latent phase. Then In the active phase of the first stage, the cervix is going to dilate from the 4 centimeter to the 10 centimeter. From the 4 centimeter to the 10 centimeter, the contraction will begins stronger, longer and more frequent. In the latent stage, the contraction, uterine contraction will be mild. In the active phase, the contraction will begins stronger and rapid uterine dilatation will be there, and also fetal is going to descend. The descent of the fetus cephalic or fetal head is going to descend in the active phase. First latent phase 0 to 4 centimeter dilatation, uterine contraction will be mild, and also the thickness, the uterine contraction will be mild and the thickness of the cervix will be begins in the cervical effacement or thickness will begins in the latent phase, and also duration primigravida and multigravida will be different. In primigravida up to 20 hour and the multigravida up to 14 hour. In active phase of the first stage, cervical is going to dilate from the 4 to 10 centimeter. Contraction will begins stronger, longer and the frequent, and also rapid cervical dilatation will be there up to 10 centimeter will occur here only. Then fetal descent, the cephalic or head presentation, if the based on the presentation, the descent of the fetus will begins in the active phase. Physiological changes at the first stage of the labor, uterine contraction will occur here only. In the first stage, uterine contraction will occur, then cervical effacement thickness will start in the first stage, and also the cervical dilatation, and bag of water will form in the first stage of the normal labor. Show will occur here. The show means the blood clots or the blood stains will stain from the birth canal or uterus. Then rupture of the membrane and fetal will get descent. The presenting part will get descent in the first stage of the labor. These are all the physiological changes during the first stage. Next, in the first stage, how we can assess or monitoring the labor, how we can assess the monitoring the progress of labor and also the mother and the fetus by using partograph. The partograph, it is the graphical tool used to monitor the progress of the labor and the condition of the mother. Partograph, it is the graphical tool used to monitor the progress of labor, condition of the mother and the fetus at the time of or during the labor time, that we will call it as partograph. The partograph, it is the graphical tool which we are going to use to monitor the mother and the fetus condition and also the progress of the labor. Then what are all the things we can assess or monitor by using the partograph in the labor? First, we can assess the fetal condition like fetal heart rate. To assess the fetal heart rate and the movement of the fetus and the position and presenting part can assess in the monitor of the fetal condition. And monitoring of the progress of the labor, the cervical dilatation and descent of the fetal head or presenting part, and uterine contraction, and monitoring the maternal conditions by using the partograph. These are all the what are all the things we can monitor by using the partograph in the labor? Fetal condition, progress of the labor. In the progress of the labor, cervical dilatation, effacement and fetal head, descent of the fetal head and also the uterine contraction. Last, we can assess the maternal conditions. This is regarding partograph. The partograph, this is the graphical tool which we are going to use to monitor the both mother and the fetus condition and also to assess the progress of the labor. We can assess the fetal condition, progress of the labor and cervical dilatation. In the progress of labor, cervical dilatation, descent of the fetal head, uterine contraction and also monitoring of maternal condition. Next is Assessing and monitoring the fetal well-being. How we are going to assess and monitor the fetal well-being? It means the assessment and monitoring the fetal well-being involves evaluation of the health status of the fetus during the pregnancy, labor, to ensure the adequate oxygenation and detect the fetal distress early. To assess the fetal condition at the time of labor, delivery, after the delivery also, we are going to assess and monitor the health condition and health status of the fetus, that we will call it as assessment and monitoring of the fetal well-being. Assessment and monitoring of the fetal well-being involves evaluation of the health status of the fetus. It may be during pregnancy, labor, to ensure the adequate oxygenation and also to prevent the breathing difficulty or fetal distress. To prevent or to identify early, we are going to do the assessment and monitoring. Which are all the methods we are going to do, or which are all the method we are going to do to assess the fetal well-being? That includes, first one, we are going to assess the fetal movement count, then fetal heart rate, ultrasound examination, fetal heart rate monitoring, and amniotic fluid assessment. These are all the monitoring or methods to assess the fetal well-being. Next, evidence-based care during the first stage of the labor. In the first stage of the labor, what are all the evidence-based care we are going to do? Continuous emotional support, freedom of the movement and the position changes for the mother, and breathing and relaxation techniques for non-pharmacological disease. Non-pharmacologically, how we can assess or how we can evidence-based care during the first stage of the labor. Continuous emotional support, freedom of the movement and position changes, breathing techniques we are going to give for the mother, massage and therapeutic touch, comfortable environment, oral fluids and the light diet to maintain the hydration of the body, warm bath and position for the comfort. Last, continuous monitoring to prevent any complication for the both mother and the fetus. Next is pain management. This is also non-pharmacological pain management. Non-pharmacological pain management, continuous labor support, breathing technique, relaxation technique. Without any medication, how we can control or how we can manage the pain? Continuous labor support, breathing technique, relaxation techniques, and position changes, and massage and therapeutic, hydrotherapy, heat and cold therapy, music therapy. Without using the medication, how we can control the pain or how we can manage the pain? Next is, these are all regarding first stage. First stage or dilatation stage, that we will call it as. The second stage, the second stage of the labor. The second stage of the labor begins with a full dilatation of the cervix, that is 10 centimeter, and ends with the birth of the delivery. The duration for second stage, for primigravida up to 2 hours, for multigravida less than 1 hour. This is regarding second stage of the labor. First stage is dilatation, second stage it is expulsion stage. Here it is going to start from the full dilatation of the cervix and ends with the delivery of the baby. The duration for primigravida and the multigravida, primigravida up to 2 hours and multigravida less than 1 hour. Next, physiological events in the second stage. The complete cervical dilatation will occur in the second stage and it will be there, and descent of the fetal head, increased strength and frequency of the uterine contraction, maternal bearing down effort. Here the mother will feel to push. Then crowning, the fetal head will be visible in the cervical. The cervix will be dilate until 10 centimeter. Here the cervical, here the cephalic or the head of the, which part is going to present, that the cervix, it is going to visible in the cervix, that we will call it as crowning. Birth of the baby will occur in the physiological events of the second stage. Next, mechanism of the labor. This is very important for exam also. First stage and the second stage. First stage, it is dilatation until 10 centimeter. The cervix is going to dilate. In that latent stage and the active stage. Latent stage from 0 to 4 centimeter dilatation. Active stage from the 4 centimeter to 10 centimeter dilatation. The dilatation, complete dilatation of the cervix will occur in the first stage. In second stage, it is going to start from complete dilatation of the cervix to delivery of the baby. How the baby is going to deliver, that we will call it as mechanism of labor. It contains these steps. First one, engagement. Second one, descent. Third one, flexion. Internal rotation of head, crowning, extension, restitution, internal rotation of shoulder, external rotation of head, and expulsion. These are all the steps which present in the mechanism of the labor, which occurs in the second stage. In that, we can study one by one. First one, engagement. Engagement, it takes place when the biparietal diameter of the fetal head has passed through the pelvic inlet. The pelvic inlet, the biparietal part of the biparietal, okay, the biparietal diameter, the biparietal diameter of the fetal head is going to pass through the pelvic inlet. The pelvic inlet is going to pass. Here, this diameter of the head is going to pass in the pelvic inlet, that we will call it as engagement. In primigravida, it usually occurs 12 hours. In multigravida, it will occur within the 6 hours. The engagement means the biparietal diameter of the fetal head will be passed through the pelvic inlet, that we will call it as engagement. This is first stage of mechanism of labor. In second stage, descent. Descent means here it is continuous movement throughout the process of delivery, continuous complete delivery of the baby. Until that, there will be a descent. Descent result in the number of force, including contraction and maternal pushing effort with the contraction of her abdominal muscles. It will be depend on the contraction and the pushing effort and also the contraction of the abdominal muscles. The descent means the continuous movement of, continuous descending of the fetal parts of the body throughout the process of delivery, that we will call it as descent. First one is engagement. In engagement, the biparietal diameter of the fetal head will be passed throughout the inlet. It will occur in the primigravida 12 hours, in multigravida 6 hours. This we will call it as engagement. Descent means the continuous movement of the fetal part of the body throughout the labor or throughout the delivery, that we will call it as descent. Descent will result, it will occur based on the uterine contraction and the abdominal muscle contraction of the mother. This is second one. Then third stage or third step of the mechanism of labor is flexion. As head descent, now head is got descent, it meets the resistance from the pelvic wall and the floor, and this leads to the increased flexion of the head due to the descent, continuous descent. Here the flexion will occurs with the increased flexion of the head. The head will going to get flexion, head will be flexion after the descending of the head. After descension, descending, the flexion will occurs with increased flexion will occurs with the head of the fetus. Then the head flexed, it brings the shortest longitudinal diameter. It will longitudinal diameter, short longitudinal diameter, suboccipito-pragmatic, suboccipito-pragmatic, occiput-pragmatic, suboccipito-pragmatic diameter will reaches the birth canal. It will pass through the birth canal. The suboccipito diameter, you can able to see this, the occiput, sorry, the occiput and the pragmatic, suboccipito-pragmatic, this will be passed through the pelvic or birth canal, that is called it as flexion. after the descent of the head will be increased flexion towards the body, and the suboccipito-bregmatic 9.5 centimeter, this will be passed through the birth canal in the flexion of the third step of the mechanism of labor. Next is internal rotation of the head. After the flexion, the rotation of the head will occur. The occiput leads and meets the pelvic floor and rotates anterior 1/8 of the circle. It may be rotate left or right. The head of the fetus will rotate 1/8 of the circle anteriorly to the floor, pelvic floor. It will reach the occiput. The occiput of the head will leads to the, and it will pass throughout the birth canal or the pelvis, and anteriorly 1/8 of the circle the head will rotate. In the internal rotation, it will occur internally, internal of uterus or birth canal. This is internal rotation of the head. Next is crowning. I already said what is crowning. The crowning, it is after internal rotation of the head, further descent will occur with the head, and the head will be visible in the birth canal. Occiput lies underneath of the pelvic arch. Here this diameter, biparietal diameter will be we can see the biparietal diameter in the vulva of the pelvis, or the head can be visible in the pelvic area, that we will call it as crowning. The crowning, after the internal rotation of the head, the further descent will occur and the head will reach until the pelvic arch. Here the biparietal diameter will stretches the vulva outlet, and the head will be visible in the uterine canal, that we will call it as crowning. Next step is extension. Once crowning has occurred, the fetal head violates, or it passes through it passes under the symphysis pubis and the sinciput. Face chin swipes the perineum. Once the head got rotate, internal rotation of the head, after the internal rotation of the head and the crowning, the chin, sinciput, chin and the face will swipe the perineum, and the head will be delivered. In the extension, the complete extension will occur. Then restitute. With the restitution, the occiput moves. Here again the occiput will move and 1/8 of the circle towards the sides from which started. It may be left or right. The head will rotate, complete rotation, 1/8 of the circle rotation will occur in the restitution. Then last, internal rotation of the shoulder. Once the head got delivered, now restitution happened. Before restitution, the head is going to delivered. After that, the restitution, 1/8 of the circle, again the head will be rotate. Which side? It may be lateral, left lateral or right lateral. 1/8 of the circle it going to get rotate. Next, internal rotation of the shoulder. After the delivery of the head, the internal rotation of the shoulder will occur. The anterior shoulder reaches the pelvic floor, rotate anteriorly 1/8 of the circle. Again the internal rotation of the shoulder will occur, and the shoulder lies in the anterior posterior diameter of the pelvic outlet. This head, this shoulder will be rotate. Once the head got delivered, this shoulder will be rotate internally 1/8 of the circle, and it will reaches the anterior posterior diameter of the pelvic outlet. It will come out from the pelvic outlet. 1/8 of the circle it is going to rotate. Next, external rotation of the head. Once the internal rotation happen, again the twist between the shoulder and the head. Once the internal rotation of the shoulder occurs, means again there will be a twist between shoulder and the head. So to correct that, external rotation of the head occur. The head rotates again 1/8 of the circle. The head rotate again 1/8 of the circle towards the symphysis pubis. Again it will get rotate towards the symphysis pubis from the oblique diameter. From the oblique diameter it will rotate again towards symphysis pubis until 1/8 of the circle. That is external rotation of the head. At the last, lateral flexion of the body and head. The body and the head and the shoulder togetherly, it is going to deliver in the lateral position. At the last, the lateral flexion and the body and the head. After the shoulder are delivered, the body is borne by the lateral flexion flowing the curve of the corns. Once the head is going to deliver, both the shoulder will be flexed with the pelvic outlet and it is going to delivered by the lateral flexion. That we will call. These are all the points or steps in the mechanism of the labor which occurs in the second stage. First one is engagement. Here in the engagement, the head will be fixed in the pelvic valve. It will occur usually in the primigravida 12 hours, in the multigravida 6 hours. In descent continuous process, here the descent will be occurs throughout the labor. In the flexion, again once the descent occurs, after that there will be a flexion with the head, increased flexion towards the body, and it will begins the suboccipito-bregmatic will be passed through the birth canal. Next, internal rotation of the head. The occiput leads and rotate 1/8 of the circle anteriorly, 1/8 of the circle, and it will reaches the pelvic floor. Then crowning, the head will be visible. The diameter biparietal, through the biparietal diameter, the head will be visible in the pelvic outlet. Then extension, here the sinciput, chin and the face will be swipes the perineum. The head will be delivered. Then restitution, once the head got delivered in the extension means here the chin, face and the sinciput will be swipes the perineum and head will got delivered. After delivery of the head, here again restitution, the twist between the shoulder and the head will occur. To correct that, there will be a restitution. The restitution, the occiput moves again 1/8 of the circle. Again the occiput will move towards the side of the which lateral or left lateral or right lateral. It is going to turn 1/8 of the circle. Next, once the external rotation of the head happen or restitution occur means the internal rotation of the shoulder is going to happen. 1/8 of the circle it is going to rotate. Then last one, external rotation of the head. Once again the internal rotation of the shoulder, again there will be a twist between head and the shoulder. To correct that, the external rotation 1/8 of the circle, it will rotate towards the symphysis pubis. At the last, the baby or the fetus is going to deliver lateral flexion. This is all regarding the mechanism of the labor. Then intrapartum monitoring. How we are going to monitor the intrapartum? Vital signs, fetal well-being we have to monitor, progress of the labor. Then maternal monitor, intake and output. Vital signs, the normal temperature, pulse, BP of the mother. Fetal well-being, the fetal heart rate, movements of the fetus and the presentation of the fetus, monitoring progress of the labor. To us here we are going to assess the cervical dilatation and the cervical effacement. Then maternal monitoring, that we will assess the weight, vital signs of the mother. Then last, intake and output of the mother we will assess in the intrapartum. Then birth position choice. The birth position choice, it is refers to the position that woman chooses, which position feels comfort for the mother. The mother is going to choose the position at the time of during labor and the childbirth, that we will call it as birth position choice. The commonly used positions like upright position, sitting position, squatting position and the sideline position or lateral positions. which the mother is going to choose the position for the delivery. Then essential newborn care, this is also important. The essential newborn care, it is a set of evidence based intervention, non pharmacological intervention provided immediately after the birth during the first day of the life, ensure the to assess the health condition of the fetus, growth and development of the newborn, that we will newborn, that we will call it as essential newborn care. The essential newborn care are the set of evidence based process or evidence based intervention provided after or immediately after the delivery and the first day of the life of the newborn, to identify the health or to monitoring the health status of the newborn, growth and development of the newborn, that we will call it as essential newborn care. The components of essential newborn care includes immediate drying of the newborn, immediate drying, provide warmth to the newborn, assess the breathing, delayed cord clamping, skin to skin contact to control any infections or any kind of the problem or complication for the fetus, early initiation of the breastfeeding and also eye care, vitamin K administration and weighing and identification, immunization for the birth. These are all the components for the essential newborn care. Immediate drying, provide warmth, assessing the breathing, delayed cord clamping, skin to skin contact, early initiation of the breastfeeding, eye care, vitamin K administration, weighing and identification, and last immunization for the birth. Next, immediate assessment and care of the newborn. Immediate newborn care refers to assessment and intervention provided to the newborn immediately to ensure the successful adoption to extrauterine life, after to assess the health condition of the baby and also assess or ensure the successful adaptation. Once the baby entered to the extrauterine life, we are going to assess how the health condition of the baby. Here first what we will do, immediate assessment. In that first we will assess the breathing of the fetus. Breathing of the fetus, check if the baby is crying or breathing normally. Once the baby got delivered, it has to be cry. If it cry means it will be normal and the normal breathing will be there. We have to check that and observe the chest movements and also respiratory effort in the assessment of the breathing. Next one, assessment of the heart rate. First we will assess the assessment of the breathing. First we will assess the breathing, second we will assess the heart rate. The normal heart rate for the newborn is 120 to 160 beats per minute. We have to assess that, and if the heart rate is less than 100 beats per minute, it needs the immediate attention or immediate treatment for this. And we will assess the color of the newborn. Pink color indicates the good oxygenation. Cyanosis or bluish color, there will be a less oxygen supplied to the body. Then last and main thing is UPCAR score. UPCAR score we have to assess. UPCAR means appearance, pulse, grimace, activity and respiration. If we have to give the score for this assessed after the delivery within 1 to 5 minutes after the delivery or after the birth of the baby. Here the criteria includes appearance, pulse, grimace, activity and respiration. If we have to give the score 0, 1, 2 based on this criteria, we have to give this one score. For appearance, if the appearance is blue or pale color, we have to give the score 0. If the body color is pink or bluish, blue extremities, pink body and blue extremities means score 1. Complete pink means score 2. Pulse absent means 0. Less than 100 means 1. More than or equal to 100 means 2, because the normal respiratory rate will be 120 to 160. Then grimace, if no response means 0. If weak response means 1. Continuous or after delivery, if started to cry means the score will be 2. The activity no response means 0. Some flexes will be there, flexions will be there means score 1, and continue or active movements is there means score 2. Then respiration absent means 0, slow or irregular respiration means score 1, and good crying means score 2. This APCAR score also important. It may be 2 marks or 5 marks they will ask for exam. This is all regarding the normal labor, stages of the labor, and progress assessment and the management of the labor or during labor. Then mechanism of labor also important. This continuation, this first and second stage finish, third and fourth stage I am going to continue in the next part 2 video. This is all regarding today's class. I hope you all understand. The mechanism of labor and the APCAR score are important in this. If you have any doubt, you can message or contact. Thank you.